come in.
Hello, my name is Ethan Borowski. I'll be your student nurse for today. Can you give me your full name and date of birth?
Peter Parker,
And your birth.
September 4th, 1970.
Okay, let me provide hand hygiene, as well as provide privacy and get all my equipment together. The doctor's ordered a physical assessment, so we're just going to go through all the parts of the body, and that should be everything. Are you having any pain of any sort?
No, nothing new to speak of.
Next, I'll assess your head and face. I'm going to inspect your head and face for general size and symmetry. Okay, and it's normocephalic, or the head shape is normocephalic, and it's symmetrical looking. Do you have any facial drooping of any kind?
No, not that I know of.
Okay. Next, I'll assess the ears. I'll look at the external ear structure on both sides. Okay, that seems to be normal. And then I'll evaluate your hearing. So I'll do the whisper test. And
I wear hearing aids,
you wear hearing aids. Okay.
so you might have to whisper a little louder.
Okay. So yeah, I'll just stand arm length away, say a 3-word syllable, and then cover one ear. I'll say it, and then cover the other. So cover one ear, one of your ears. The sky is blue.
Okay, you said the sky is blue.
Okay, then cover the other ear. The sky is blue.
You said the sky is blue.
Okay. Hearing seems to be okay, and no trouble hearing or anything.
I wear hearing aids,
Well,
so
okay,
yes,
okay.
I do.
Okay.
But I go to an audiologist for that.
Okay. Next, I'll assess your eyes. So first, I'll do the pupillary light response. I'll look at the direct and the indirect. So I'll use my light here. I'll shine in your eye. Okay. Dilated. Then I'll shine in your eye again and look at the opposite side. Okay. There's direct and consensual pupillary response. Then also follow the pen when it gets close to you. Okay, there seems to be accommodation as well, and the pupil size is 4 millimeters. So your pupils are equal, reactive, round, and there is accommodation and reactive to light. Do you have any changes of vision or anything?
No,
Okay.
not recently.
Okay. Next, I'll assess the nose. I'll just inspect. Okay, your nose seems midline. Then I'm going to check for nostril patency, so cover one nostril and then just breathe, and then do the other. Is there any blockage or anything?
No.
Okay, it's good. And is there any drainage or anything coming from your nose?
No.
Okay. Next, I'll assess your mouth, throat, and neck. So shine my light. Okay. Look at your mucosa, it's pink and moist, and there was no decay on your teeth or anything. Is there also any trouble swallowing?
No.
Can you swallow for me, please? Okay. Then next, I'll inspect your neck. Okay, your trachea is midline, which is good. Next, I'll assess the neurological. Look at the consciousness and orientation. So, what is your name again?
Peter Parker.
Okay, where are you?
I'm in the doctor's office.
Okay, about what time would it be?
It's about 6:30.
6:30. Okay, and why are you here?
Just for a standard physical.
Okay. Okay, you have good orientation. Next, I will explain the Glasgow Coma Scale. So this is to measure consciousness after brain injury, but you don't have any brain injury, so we don't have to check for that. And each category is checking for like eye opening, verbal response, and motor response. Do you have any memory loss of any kind as of late?
Mm-mm.
Okay.
No.
Next, we can move on to the respiratory portion. I'm going to just listen or look at your respirations. Just breathe normally for me. Okay. Your respiration rate seems to be normal. No abnormal effort of breathing, and the pattern is normal. Next, I'm going to listen with my stethoscope directly on your skin, on the anterior, posterior, and lateral sides. Just listen for your breathing. I'll do this in the correct pattern. And on the posterior side, doing the same pattern. Okay, then on your lateral sides, this side. Okay. Breathing seems to be normal. Normal pattern, nothing abnormal. I didn't hear anything, just normal breathing sounds. Next, I'll educate you on the turn, cough, and deep breathe technique. So there's this technique, you would turn, you would breathe deeply, catch all that mucus, and then cough it out, which would help with breathing. And then the other part would be incentive spirometry, which is this. To do this, you would exhale or breathe in, hold for 3 to 5 seconds, and then, you know, if you had to cough or anything, you would cough and then breathe normally after that. And you would do this 10 times in an hour, not back to back, but 10 times an hour. And this will also help breathing and help clear up any mucus or anything.
Okay.
Do you also have any cough or sputum production?
No.
Okay, and no trouble breathing?
No.
Okay. Then I'll assess the cardiac. I'll first look or inspect for the jugular venous pulse. So I'm going to look at your neck and then on the other side. Okay. Doesn't seem to be any distension. I would normally do this at a 30-degree angle, but there doesn't seem to be any distension. Next, I'm going to palpate your pulses. So let me do that. I'm going to do that bilaterally as well and rate the strength. So I'll do or this way. Fine. Okay, radial seems okay. Now I'll do your posterior tibial, which is behind your ankle. I'll do that bilaterally. And dorsalis pedis, which is on the top of your foot. Okay. They have a strength of 2+, and the and it seems to be there doesn't seem to be any abnormal rhythm or anything with that. Then next I'll explain the carotid or other pulse sites, such as your carotid, which is on your neck, your popliteal, which is on the opposite side of your elbow, the brachial, which is popliteal, which is behind your knee, brachial on the opposite side of your arm, femoral, which is in your groin area, and axillary, which is under your arm. Next, I'll assess capillary refill, so I'll pinch your fingers. Okay, less than 2 seconds. I'll do that bilaterally, then do it for your toes as well. Okay, those were also 2 seconds or less, bilaterally, which is good. And then also I'll assess for edema, so I'm going to squeeze bilaterally. Okay, and on your feet and legs as well. Okay, doesn't seem to be any edema. Okay, next I'll listen to your heart sounds. So I'm going to put my stethoscope directly on your skin and listen for any abnormal. I'll use the diaphragm for this, listening to those high sounds. I'll do aortic, pulmonic, herbs, tricuspid, and mitral. I'll also hold here for 1 minute and listen to the apical pulse. Okay, that was 1 minute. Nothing abnormal. Also a 2+ strength. And that was directly with your skin. And yeah, using the diaphragm to listen for S1 and S2 and higher rhythms. But I would use the bell, which is the opposite side. That would be for lower rhythms, such as S3 and S4. Those would be abnormal sounds, but I didn't hear any of those, so I don't have to check for that. Do you have any chest pain or anything?
No.
Okay. Next, I'll do the GI. So I'm gonna first inspect your abdominal area. Okay, it seems to match your ethnicity. There doesn't seem to be any bumps, bruises, lumps, or lesions, or anything like that. Next, I will first lay you down, and I'm gonna listen to your bowel sounds. In the 4 quadrants, I'll first start with your lower right, and then I'll do upper right, upper left, and lower left. Okay, you can sit back up. Okay, it doesn't seem to be abnormal bowel sounds or anything. Everything seems to be okay. And then next I will palpate your abdominal area, so actually please lay back down for me. Okay, same thing, I'll lightly palpate in all the quadrants, doing it in a circular motion as well. Okay, I don't feel anything abnormal, and now you can sit up for me.
Okay.
When was the last bowel movement you had?
Oh, I had one this morning about 9 o'clock.
9 o'clock. Okay. Did you pass any flatus or did you fart at all at any point today?
I probably did.
Okay.
I probably did.
Okay. Is there any abdominal pain or anything as well? Are you in any pain?
No.
Okay. Then next I'll assess the musculoskeletal. So I'm going to check for range of motion on your upper and lower extremities. So I'll do the elbow and wrist. And feel for any popping or so just move. Okay, there doesn't seem to be any popping or scraping. Are you in any pain?
Nope.
This side as well. Just bend for me. Okay, same thing. Next I'll do it on your wrist. So just flex them for me. Okay, no popping or scraping.
Mm-mm.
No pain either.
Nope.
Okay. Next I'll do it on your lower extremities. So just I'll do your knee on both sides. Just bend them for me. Okay, no popping or scraping, any pain. And then also your ankles as well. No popping or scraping.
Mm-mm.
Okay. And then also I'll test for strength. So I'll push against you. So push, okay. Then I'll pull. Okay. Same thing with your feet. I'll push and then pull. Okay. Strength seems to be there. Your range of motion seems to be good. Next I will assess gait and balance. So can you walk partly across the room, then walk back? Okay. Okay. You can stay standing for me. Your gait seems okay. So next I'm going to do the Longberg test. So stand with your feet together and your arms at your side and close your eyes for 30 seconds. Okay, that was 30 seconds. You seem to be okay. You weren't losing balance or anything. You were standing still, which is good. So your gait and balance are correct. Do you have any trouble walking or moving or anything like that?
No, not really.
Okay. Do you also have any trouble like urinating or anything? Avoiding, okay.
No, I don't.
So next I will educate you on the Morse fall scale. So that's just checking for the risk of falling and things like that. And we check for like history of falling, but you don't have any
No,
history
I
of
don't.
falling. No secondary diagnosis, and you don't use any furniture or anything to walk or
I
a
don't.
cane.
I
Okay.
don't.
You don't have an IV, and your gait seems to be okay, and didn't need any help transferring, which is good. And your mental status seems to be okay. Then I'll educate you on fall education. So when you're at home or in the hospital, do not like lean on anything, any furniture or anything like that, because that's unsafe. Also have good lighting so you can see things. So you don't knock into anything. Don't have any loose rugs or anything just laying on the floor. So once again, you don't fall, and that you just stay as safe as possible. But I think that seems to be everything. So the doctor will see you shortly.
Okay, thank you.